Good morning, ladies and gentlemen. We have 1 minute warning. Good morning, councillors, ladies and gentlemen. First of all, welcome to this meeting of Staffordshire's Health and Care Overview and Scrutiny Committee. Today's date is the 18th of March 2024. I am your chair, Councillor Jeremy Pert. This morning I just want to start off with a couple of comments. First of all, there has recently been a change in the Cabinet Member for Health and Social Care within the County Council. I would just like to note the support and insight that Councillor Mrs. Julia Jessel gave this committee over a number of years, and to thank her for her support and insight and challenge. Are we happy to note that as a committee? Thank you. Obviously, we, in the same breath, or the next breath, welcome the new Cabinet Member and recognise Councillor Mike Wilcox, and recognise that he has a big act to live up to and some big shoes to fill, and we hope that he does that and also gives this committee the due deference that it deserves in terms of supporting him and his colleagues in social care within the county. Finally, I just wanted to mention Wally's Quarry. Members may be aware that the Environment Agency issued an abatement notice to Wally's Quarry a couple of weeks ago, and disappointingly that has now lapsed, and Wally's Quarry continues to take in waste, and I think we may want to, when we look at the work programme, may want to consider what further work needs to be done on Wally's Quarry, and I note that we've got the local members here, or the local member here, and I would appreciate his insight into that as part of the work programme discussion. Thank you. So that brings us on to the agenda proper this morning. It is apologies. Zach.
Good morning, Chairman. I've received apologies from Councillor Chapman, Councillor Peters and Councillor Holton.
Thank you. And just for the minutes, can we just confirm that we are quorate, please?
Yes, Chair.
So thank you. Item number 2, declarations of interest. Anne Edgeler.
Good morning, everyone. Yes, I declare an interest. I'm partner governor from the County Council on Midland Partnership Foundation Trust.
Thank you, Anne. Duly noted. Any other? David?
Thank you, Chair. I'm a physiotherapist at the University Hospitals of Derby and Burton, and also a staff governor.
Duly noted. Thank you. Any other declarations? Not seeing anyone. Thank you. So that moves us on to agenda item 3, the minutes of the meeting, of the last meeting held on the 29th of January 2024. Have we been through the minutes, and does anyone have any comments on the minutes in terms of accuracy? I have a couple, if I may, please. First of all, on the item that relates to social prescribing, page 8 of the agenda pack, item 57, Gary Jones has got a double R in Gary, first of all. And the other two relate to just carrying forward the actions from the committee that was agreed. On page 7, it notes that the committee requested to understand specific practices which were below the recommended guideline number of appointment rates. That just needs to flow through into the actions at the end of the meeting, which is on page... on page 8. And similarly, we also need to pick up on page 8 the last bullet under the GP access element, which says the committee requested to receive the GP retention schemes from the ICB. That also just needs to carry forward, please. And I would suggest that in terms of page 9, we refer to the ARRS, R's roles. We'll just add in the longhand version of that the first time, because otherwise people reading the minutes in a year or two's time may struggle to understand what the abbreviation means. Otherwise, apart from those changes, are we happy to accept the minutes? Thank you. I'm reliably informed that all actions have been followed up where we have the answers. So that takes us on to the next agenda item. With committee's permission, I would like to bring forward the item on item 5, Adult Social Care Working Group. This item was brought forward because of the CQC inspection that will happen within all upper tier local authorities into social care. And if committee members, we set up a working party that was chaired by Councillor Richard Cox. So I'm going to hand over to Richard to talk through the working group report.
Thank you, Chairman. Good morning, all. So before us at page 67, we've got our report front in terms of bringing a working group together to deal with the forthcoming Care Quality Commission. And I think we robustly went through on a number of meetings, and in fact, indeed, came out with 14 recommendations to go forward. I certainly thank Amanda and Joe for their diligence and guidance in it, but I think it was also to be noted that the councillors raised items that they also felt were absolutely right and proper. And that's hence why we have 14 recommendations to go forward. So I think, obviously, I expect that you've read the report. I'm happy to present that to the committee. So if there are anything that you wish to raise within it, but I do thank those members that participated, and indeed the officers in question. So I'm open to questions. Thank you very much.
Janice, good morning.
Good morning, everybody, and also Councillor Cox. Thank you for this detailed and comprehensive report. And I can say that we're noting the recommendations, and there's a number of those that have been given in there, which I think absolutely goes back and satisfies what the information was established at the beginning. My particular, more so, I would say, request as well as the information that's been cited is item, I think it is 48.9, looking at safeguarding and the formal links between the committees and establishing what work needs to be done there, not least the sharing of information when it comes around to the health inequalities. I would be requesting some oversight as well of that, please, because some of the work that we've been doing as part of the Women's Health Strategy is very much down to the inequalities that exist, and I would be very keen to see some of that information when it's available. But yeah, I think this is a very worthy set of recommendations that are coming through. Thank you.
Sorry, Charlotte. Good morning.
Good morning. Yes, I'm just going to make a comment about the disabled facilities grants and the fact you talk about a good relationship between the County Council and the district and boroughs. You might be surprised to learn that there's been a historic lack of spending in the Staffordshire Moorlands, where presently there's £5.6 million sat in the DFG fund, which indicates, I think, a lack of priority given to that in the past, but also the fact that we were lumbered with Millbrook Healthcare, which made it incredibly difficult to progress any DFG application. Luckily now, certainly the Staffordshire Moorlands, we no longer use them, but hopefully in the future things will improve. and we're certainly, as a new administration, keen to get that spent to make sure that people with disabilities can live as independent a life as possible. One of the other issues which I think you've identified is around dementia and the need to raise the profile of dementia and particularly preventative work. And what worries me is that there seems to be very little real work being done across the county on this issue. And I don't know whether you felt that progress was being made, because certainly where I'm sitting, it doesn't seem to be something which is a priority, despite the fact that early preventative work could mean that a lot of people would not be as heavily impacted in later life.
Regarding the mental health, which I'll take first, I think we did have a good conversation with regards to that, and we had Councillor Anne Edgeler as the county's champion, very much part of that committee. I think there is a lot of association around the mental health that obviously does need to be linked together to make sure that we are covering our issues there. DFGs certainly is something that we recognise, and in fact, certainly I know that if I was to speak for my own authority at Lichfield District, that in turn was taken in-house because of the issues behind it, and I'm very glad to say that our backlog is now no longer, and we're ahead of the game in trying to make sure that those grants are put out into the public. And I would think that a number of authorities are taking it back in-house, and we'll have that same success in handling it.
Just before we move on, I just had a couple of comments in terms of disabled facilities grants. I no longer look after disabled facilities grants at a local district level, and obviously DFGs are it's a passport service effectively from the county into our district and borough colleagues. And my experience with the provider you specifically talked about is much the same, that there was a capacity limit, in most other areas of local government there is a shortage of cash, and the reality was in disabled facilities grants, which was something that was needed badly to help keep people in their homes, was often being delivered far too slowly and too late. And certainly I'm aware that the joint service that I think that you have in the Moorlands with High Peak has resolved some of that, and obviously Richard Cox refers to the Lichfield service, certainly in Stafford, that's a shared service with South Staffs, and I think is sufficiently of size and scale to deliver what's required, albeit it will take some time, in my view, to recover the backlog. But one of the key links was the number of people who were applying for disabled facilities grants from within the registered housing providers, and certainly in Stafford Borough and South Staffs, it was something in the order of 40 or 50% of the applications, and actually creating a link with the local housing provider also helped bring down the length of time it took to deliver some of those grants. But I think your point is right. It's an important facility to try and keep people in their own homes safe and well. John.
Thank you, Chair. Thank you, Richard. Just looking at page 68, and it says the CQ's, paragraph 5, it says they're going to use 4 types of evidence, and then in 6 it says, 7, it says the CQC requires the council to identify 50 people in particular categories. I just wonder, how are those people been or have been selected, and just to ask that the demographic is taken from across Staffordshire, including the very rural areas, you know where I'm talking about, and I just wonder how far down the road we were with that, and what the criteria was and how it was being done, please. Thank you.
I'm going to suggest that either Joe or Amanda picks this up because it feels like it's sort of a detailed question as to how CQC operate. Bearing in mind that they've done a few pilots and Joe or Amanda may talk through the pilot.
But Chair, with the Treasurer, Chair, it says that is a council have to do that. It's a council action to select these 50 people.
I'm still going to get Amanda to, or Joe, which one of you? Yeah, thanks.
Thank you. So the criteria we have to choose or have to use for choosing these people is set by CQC. And they are looking for sort of a real cross-section of our population, but also people from different services. So they'll want to see people who've been through hospital, for instance, and people who've been through Care Act assessments and reviews who've got a learning disability, mental health needs, older people, people with a physical disability. And what we need to do is make sure we absolutely reflect the geography of Staffordshire. So we will have to do that within the remits that CQC set, but we will make sure that we are all-encompassing in that. They will only actually really look at 6 people in any detail, so that is going to restrict you know, the numbers of people that they see and also that ability to really reflect, but they will go and meet with people and speak to them about their experiences.
Thanks for that. If I may, Chair, that's what concerned me really, because it's only just over 10% of the 50 that are going to be canvassed, and I would have hoped at least one of those would be from a really rural area, because as you know, Chair, the service that's received in the rural areas differs vastly from what we get in the urban areas, as with so many aspects of health, I'm afraid. But thanks for that. Thank you.
And I'm guessing, do we have the choice to suggest to CQC, Joe?
So we'll provide the 50 people and then they will randomly select the 6, and that will be on the basis that they're able to sort of have conversations either with the person or their carer, but we're making sure that all 50 people would be in the position to do that. So when they choose the 6, we're not then having to exclude people from that list. So in terms of whether they happen to choose somebody from a rural area, we're not going to be able to steer them in that direction, but we'll make sure that our 50 is representative across the board.
I think it's important that we get a spread on all sort of geographical areas. Thank you, Chair.
And Joe, I believe that you have been involved with some of the assessors more recently, and maybe that's a bit of feedback that you might want to take back into CQC, because I think it is a valid point. What London looks like is different to some of our very sparsely populated areas. Thank you. Any further questions or comments from anyone? Ian.
Thank you, Chair. Just looking at the partnerships, I may have missed it, so please tell me if I have. We have situations where people aren't able to look after themselves and are waiting for going to care homes that get put in hotels. Hence the reason I know I've worked in it for 4 years. The one problem we have is the staff aren't trained to deal with health issues or social care. They have their own job, and the actual percentage is anything from 1 staff member to 100 customers or 300 customers, depending on the size of the hotel, depending how busy it is. The one thing that we find really hard is we cannot get a social worker or a medic or anything to be there when they book these people in and actually stay with them. They'll book them in and then we don't see them again until they come take them out. They'll occasionally leave a phone number, an email address, but you cannot get them. It's like pulling teeth out of hens. I haven't seen anything in partnership that you've mentioned about the halfway house, if you like, but we're not a halfway house.
So this feels like a Joe question, albeit it's somewhat slightly off topic. It's sort of on topic in terms of social care, but slightly off topic in terms of the paper in front of you. But Joe, do you want to pick that up in some way, please?
So thank you. What we will always do is try and avoid using a hotel in the first instance for everything you've described, really. So it would only be in very limited situations that we would do that. We tend to see it where people have got nowhere to go, so they haven't got their own home, they're coming out of hospital, or there is an absolute dire situation that we need to try and resolve. We have had situations where we've provided care into hotels, but again, it's not ideal. If people have got care needs, ideally they'd be in a different position. We can provide 24-hour care within a hotel, but only for a really, really short space of time, and it would be dependent on the person's need and where that person's going to stay. So we have to work that through on an individual basis. So I recognise what you're saying. What I would say is that we don't do that very often. And where we do, we will make the decision about whether it is the right place to really consider that person going. And if needs be, we'll look at sort of residential or nursing care. What we do know is that working with sort of district and borough councils, that they will often look to hotels and ask us to support the individual in there. So we'll get involved then. If you've got specific cases that you want to sort of talk through, I'm more than happy to do that after this meeting.
Thank you. Keith.
Thank you, Chair, and thanks for the report, Richard, and everyone else, fellow colleagues. Two things, really. I quite like the recommendation 11, where we all start to know a little bit more about what we're trying to achieve, and some development training there will be, I think, is much needed. My first question is that going to go beyond our own membership within the County Council, our own members, or is it going to go to district members as well? And possibly beyond that, in addition, down to parishes, particularly organisations that might be working along with the community strategy, which we're all meeting up with on Thursday, to try and find out the best way of supporting everything to do with adult social care, both in the community and then through and into any necessary services. So that's number one. Number two, in terms of the engagement, I think we've already touched on that to some extent. How are we going to try and achieve not just that recommendation, number two, which I think is really important to get other input into the whole process, but how are we going to, I see that some of the recommendations are fairly straightforward in terms of, getting various members onto committees and all this sort of thing, and getting a better connectivity across what we are doing internally. But are we going to be having a regular report back on these recommendations or anything like that? That is something that I think didn't happen in the past to some other recommendations in previous working groups and everything else, which I had some experience of. And I just hope to try and make sure that these are, some of which can be done fairly promptly, but others aren't ignored in the long term, to try and really improve those services that we're meant to be looking at. A couple of questions there. I just wondered if you can make comment. Thank you.
Richard, we're with you.
Thank you, Councillor Flunder. I think in terms of the connecting with the district and boroughs, it's clear that we've obviously got to make sure that there is that connection going forward. And I think we do make reference to that in the report, but it is quite clear that there has to be a link. And I'm not too sure how far we go in terms of parishes, but certainly at district and borough level. Regarding the engagement, I think there was reference, and I know that we had a quick conversation about Staffordshire Connect. I think there probably is an argument to say that the flow through Staffordshire Connect does need to be a little bit smoother, that it should become easier to find, because otherwise it's you could find yourself in a bit of a where do I go from here view on it. So I think we can pick those in terms of, but both are referenced within the report, so I think we can say that we'll look at that, and hopefully that may answer.
Can I just have a quick follow-up? It was just how regularly are we going to be looking at this in terms of getting those recommendations through? Because I think with the Staffordshire Connects element and things like that, that is something that we're pushing. It's not just here that's relevant, it's across all the services that we're trying to promote and everything else. So it's just how regularly. I think that's something you and the Chair might have to come back on.
So the answer to the question is, this is the report of the working group, and it's for the Cabinet member to come back once he has received the report, not for the working group. There is a real clear principle, which is working groups have a tight timeline, defined timeline. Once they're finished, they should disband and move on from there. However, I think in this case, one of the suggestions from within the working group was, because there is a greater knowledge and understanding of social care now, maybe it's something in 12 months' time we might want to revisit. Not the same piece of work, because we've already done this piece of work, but maybe a dip sample to feel reassured that some of the opportunities that were originally identified can be picked up. But clearly this is for the Cabinet member to come back on. Mike, welcome.
Thank you, Chair, and good morning, everyone. I'm really delighted to be here with you. It's the first time I've been to health and care in this position, so I'm really looking forward to the challenges that you will bring forward to me running this portfolio. Mr. Chair, I just wanted to speak a bit about the CQC inspection and assurance, and to say to you that what we are doing is making sure that everybody is fully aware of an impending inspection that's going to come to Staffordshire. So we're making sure that everybody is up to speed, all the staff and everybody knows what's happening, and they're well rehearsed into what's going to be required of them. I have to say, looking at the background information that we will have to supply, it's quite time. There's a time constraint, but it's actually going to take a lot of time to put all the information together. But I am assured, and I have regular conversations with lead officers, that we are in a good place, and we will make sure the information that we need to supply to the CQC when they decide to descend on us, we'll have ready and able to sort of go forward and give that sort of assurance that we want to give to the sector that what we're actually doing is right, and we welcome that. So in relation to the report, we welcome the report from the working group, and we're more than happy to come back at some stage, as you suggest, Mr. Chairman, just to give an update on where we are, because there's some good recommendations in there that we want to take forward. So it's really important that we give that due credit and come back and explain to you exactly where we are on certain parts of that report. So we thank you for that report, Chair.
Thank you, Mike. Appreciate that. I think Kath Perry, and thank you for your input to the working group as well, Kath.
Thank you, Chairman. Just on that point, thank you for coming back to us as a Cabinet member. Obviously, there's a lot of recommendations, and we would hope that you will take on board these recommendations that are down there. And if you don't take some of the recommendations, could you come back to us and explain to us why you're not prepared to take those on board? After all, there was a lot of work gone into this over the meetings that we've had, and the officers have done their best to pull out all the issues that we raised during those meetings. So it would be kind if you could come back to us if you don't support all of the recommendations, to give us reasons why, so that we can then look at them again, maybe to to complete this process. Thank you.
I think the proposal is to programme in some time with the Cabinet member in July, which would give the Cabinet member an opportunity to go through the report. But equally, there was a second part to the invitation to July's meeting, subject to agreement from committee, which is just to compare and contrast any changes in policy or strategy that may be between the previous incumbent and the current incumbent. Is that your understanding as well, Mike?
Yes, absolutely, Chair. That's already diarised to come.
Thank you. Do we have anyone else who would like to ask any questions? So I think there's a couple of things here. First of all, there is a report that's being tabled from the working group. Are we happy to accept the report and its recommendations and to pass it on to the Cabinet member? Yep, that's great. I think you'll be really useful because there's been a huge amount of work that has gone into this. I think there was a thick end of 9 meetings from memory. And they were sort of detailed meetings that has covered a lot of areas, as you can see within the report. So there was a lot of diligence put into this by the chair and the members of the working group. I think it'd be useful to recognise that work and to thank them for their input. Yep, okay. And the final bit is, can we thank the officers involved, of which we have Joe and Amanda with us this morning, for their openness, their thought that went into the amount that's been prepared and pulled together, but also their willingness just to consider any question and whether there were other ways of doing some of the things that they've been doing, because I think it's been a very useful process, certainly from committee's perspective, because we certainly couldn't have done this through a committee meeting like this in any amount of diligence that has. So can we thank the officers as well, please? Okay, that rounds up item number 5. I think that's clear. Let's go back to item number 4, which is the Staffordshire's Joint All-Age Carers Strategy 2024 to 2029. Normally we offer you 5 or 10 minutes just to open up the report. I do note, however, this report has been to the Health and Wellbeing Board and also to one of the other committees as well. So this is the 3rd public airing of this strategy. Mike, we're with you and your team. Maybe you might just want to introduce your team.
Thank you very much, Chair. So I have with me today Jackie Averill, Commissioning Officer, and Ellie Cross, who is the SEND Commissioning Manager with me. So, Mr Chairman, we bring to you this morning the Staffordshire Joint All-Age Carer Strategy 2024 to 2029. So, if it's okay with you, Chair, I'll just go through and introduce the report, some highlights from it, and then I will pass on to both Jackie and Ellie, who will go through the actual strategy in a bit more detail for you. So, colleagues, we all know from either first-hand experience or we know of someone in our communities who are carers, and we really value the tremendous work and contribution these make across Staffordshire in supporting and helping their loved ones to live as much an independent life as possible. To that end, it's really important that we as a county support them as far as we can, and ultimately as long as they want us to. Chair, just to give some statistics about this valuable unpaid work, the 2021 census reported that in Staffordshire, nearly 10%, that's 82,000 residents aged 5 and over, provide some unpaid care each week. And a total of 66% of carers are aged over 50, of which 58% of them are women. There are also 1,610 young carers aged between 5 and 17. And to add to this, the statistic, 38% of these young carers told us they struggle to balance their caring role and in many cases going to school. And carers are more likely to suffer from poor health compared to the general population, mainly due to the lack of support and information, as well as financial concerns, stress and social isolation. So we bring forward to your committee this morning, a draft new all-age carer strategy. I'm well aware, Chairman, that Cabinet meets on Wednesday to take this report forward, and obviously there's a very small window of time for you to be able to report back into this report, but please, I really implore that you do take time this morning to look at that and give us your thoughts, because we will make sure that they are reported back to Cabinet on Wednesday. So, the draft new age all carer strategy has been developed in partnership with the ICB, that's the Integrated Care Board, and more importantly, has had direct input from carers themselves. It also recognises the extraordinary contribution the carers make up and down the country. It will also reflect how we will continually to seek the views of carers and work with them to ensure that we are aware of the support available and they're aware of that support so that they can utilise this in their own communities. We value your comments, as I said earlier, and we would like to be able to put that into the report before Wednesday. So if I might just summarise the strategy. Firstly, as I said, this document has been co-produced by the ICB and other partners, including the provider of the carer support services, Staffordshire Together for Carers, professional and unpaid adults and young carers. An extensive period of co-production between August and November of last year, 2023, with a whole range of stakeholders, including MPFT. Feedback was captured from various sources, including online and paper surveys, as well as specific focus groups of both families of young carers and young carers themselves. In total, over 412 carers contributed their views, broken down into 379 adult carers, including parents and council employees who are also carers, 20 young carers and 13 families of young carers, and a summary of those can be found in Appendix A. I have extracted some of the feedback from those who engaged with us through the survey. Many said it was difficult to find information about support, services and benefits. I would not know how to access support or respite care if I needed it, a few people said. A professional who they had met during the previous 12 months had not identified them as a carer or offered support. So we're talking about this to GP social care officers. Many also said that caring had caused some or a lot of financial difficulties. Another supporting of carer-friendly communities, many said, I do some things I value or enjoy, but not enough of them. Others said, I have some control over my daily life, but not enough. And I am neglecting myself or sometimes can't look after myself well enough. This is the message that we're getting back from carers, Chair. So, colleagues, it's really important that we listen and act upon what we have heard and put in place this new strategy that will help and support and signpost, as well as creating that working relationship with carers, and that we ensure that they feel valued and know where to turn if things start to get on top of them. The draft of the strategy has also been shared with the Learning Disability and Autism Spectrum Condition Carers Forum on the 15th of January. Comments from this forum were around producing an action plan in a timely manner to ensure actions are achieved and that carers stay involved. The strategy also sets out the 7 main priorities, each with associated outcomes and performance indicators. And again, those priorities and outcomes are listed at points 8 and 9. Under the governance arrangement, colleagues, the Scrutiny Committee is asked to consider the strategy for adoption, as will the ICB through their own governance arrangements. The Health and Wellbeing Board, as you have heard, have discussed it at their meeting on the 7th of March and have endorsed it. Once approved by Cabinet, the new strategy will commence from April 2024. The action plan will be incorporated to support implementation. Under legal implications, this new strategy is simply a replacement for the existing current strategy, and there are no legal implications arising. The strategy will also be implemented with existing resources. The finance team are anticipating the same level of funding for the delivery of the care services from the Better Care Fund for future years. However, an inflation amount has not been confirmed for 24-25, and therefore we're not anticipating an uplift at this point. Under climate change implications, there may be some minor implications if we deploy community workers, although hopefully the utilisation of technology to facilitate connection of social networks for carers that will mitigate the need to travel all the time and therefore will have a positive impact on potential carbon emissions. Finally, the strategy reflects national policy and legislative requirements, as well as local strategies and plans, including national and local data and carers' feedback about their priorities. It also links into our strategic plan. Chair, I will stop at that point and let my officer colleagues come in, talk about the strategy, and then we'll happily take questions from members. Thank you.
Hello, thank you. I'm Jackie Averill. I'm a commissioning officer in the Learning Disability, Autism, Mental Health and Carers team, Care Commissioning team. Just to say, we are expecting a colleague from the Integrated Care Board, Claire Taylor, to join us as well. And so thank you for moving the two items on the agenda around so that we could be here. Councillor Wilcox has really set the scene very well about our approach to the new strategy and the engagement. So I'll add to that by just picking upon what's new, if that's okay with everybody. We did start from the position of, we didn't start from scratch when we started to engage around the new strategy. We took the point of reference that the 7 priorities in the current strategy are still universal and relevant. And this is the information that we got back from carers, that they are sort of still very timely, they're universal relevant. Carers aren't necessarily seeing the impact as much as we'd like around the existing strategy. So we know we need to do more in how we deliver the new strategy. Just to add to that, so the priorities within the strategy they continue to be 7 existing priorities: identifying carers, improving information, advice and guidance, staying healthy, assessment and support planning, short-term and longer-term planning, and that is a slight update on the existing priority, which is crisis management, and that recognises that what carers said to us in the feedback is that they're concerned about what will happen when they can no longer continue to care. Other priorities are a life outside caring and recognition and value, and that came across really clearly, that people the carers don't feel as though they're being recognised or valued by professionals. What also came back really clearly in the feedback from carers is that we're missing key opportunities to identify carers very early on in their caring journey. So that might be when they go to the primary care surgery or they meet a social care professional. And I think that one point really is really important point to consider, and it's something we very much need to build on in the new strategy, to look at how we ensure that we work with primary care surgeries, in particular schools and social care professionals, to make sure that they're aware of carers and aware of carers, the support that is available to carers, so that they can signpost carers to support when they need to be signposted or to services as appropriate. It's also probably worth noting that the vast majority of carers actually won't require or want a level of formal support. They would want information, advice and signposting. They want to know where to go for information. They want to know where to go for perhaps local services or more information about diagnoses or health conditions. So looking forward to the new strategy, what's new, what essentially is new in the new strategy, is we are looking at a digital support solution. So that is something that will help us to identify carers, and it will help carers to self-identify. And we have submitted a bid to the Accelerating Reform Fund very recently, and we were told in January this year that we have been successful. And one of the parts of that bid was around a digital support solution, which will help carers to self-identify and to access services if they need to. We are going to be co-producing a range of affordable carers opportunities to take a break using the carers budget. One of the key things I think is a really important one to note is that we have developed our own carers awareness training. That is a local carers awareness training offer. So that is done by the service manager in First Contact team, who does the vast majority of carers assessments, and the service manager from Encompass, who provide our Stafford Together for Carers service. So that is very much about what is available here in Staffordshire, how to access it, what the referral routes are. So it has a very local flavour, and I think that's going to be very helpful. But we're making that, under the new strategy, it's proposed that we make that carers awareness training mandatory for social care professionals, and we're going to recommend that it's also uptaken by health staff. We're going to explore underrepresentation of minority ethnic groups, because that came out when we were looking at the data for the new strategy, that there's certain groups, including ethnic minority groups, who are underrepresented in carers services. And we also have introduced in the new strategy metrics included to measure the progress, and most of these are already in place, so we're building on what is already there. So work in progress, we have already looking at the feedback from carers which took place last year. We have some work in progress already. A business case was approved at the end of last year to increase young carers' capacity or sort of capacity for one-to-one support for young carers, to increase one-off direct payments for carers to enable them to support them to sort of take a break or to engage more in their hobbies or go to a gym which has, for example, this is one that was approved recently, somebody where a carer has a health condition and they needed to access a pool with warm water. So it's those kind of examples. We're also going to be looking at how we expand the number of carers champions in school and primary care surgeries and improve the range of groups and activities. As I mentioned previously, we have submitted a successful bid against the Accelerating Reform Fund. One is for the digital solution to encourage carers to self-identify and access support. But we recognise that digital doesn't work for everybody and other people will be excluded, perhaps because of rural issues. They don't have good broadband cover in their area. They might have minor physical disabilities that prevent them from using sort of the full scale of digital options available to them. So the second part of the Accelerating Reform Fund bid was for an engagement and participation role, and that will help us to support carers in the community, and it will help us to identify underrepresented carers and enable them to self-identify as a carer and to access carer services. So the next steps in terms of governance, I have a meeting later today with the Improving Population Health Portfolio Board with the ICB, and we'll be looking at how we can work better with primary care surgeries to support them to be able to recognise and signpost carers to carers services. And as Councillor Wilcox said, it's going to Cabinet on the 20th of March. After March, we will be looking at how we co-produce the action plan, and we're going to be planning the approach to this quite shortly. Governance, we have recognised that we need to sort of improve the overall governance for the strategy. So the Carers Partnership Board will continue to be responsible for overseeing implementation, and that will report annually to the Health and Wellbeing Board via the Disability and Neurodiversity Partnership Board. So there is greater overall oversight of delivery of the strategy. Thank you.
Thank you, Jackie. We're lining up a whole range of speakers on this one. Anne Edgeler. Sorry, I thought you'd taken a breath and that meant we were done because we're stretching the 10 minutes. But please, Ellie.
Thank you. I'm Ellie Cross, then Commissioning Manager for Children and Families. I'm going to just briefly summarise what we know about young carers. So, young carers and their families told us it's important to be identified as a young carer as early as possible. There needs to be more awareness of young carers in schools and their communities. We know that sometimes there's a delay in identifying young carers, and in one case that we know of, it took up to 6 years to do this. We also know that there's a disparity between what young carers and their families are telling us. Often young carers are telling us that it's fine, it's just what I do, whereas families are able to recognise and express concern actually over the wider long-term impact on education, social life, and the ability to be a kid and have some fun. Both young carers and their families really value the support they get from Staffordshire Together for Carers, and for some, this is the only support that they do get. And in terms of priorities, as we've covered, priorities are mainly the same, but they have been updated to reflect what young carers and their family tell us, which is crisis management, short-term and long-term planning, and the outcomes are more focused. So that was just a little bit of a summary for young carers. Thank you.
Thank you, Ellie. I'm going to now invite Anne.
Thank you very much, Chairman. Thank you for your report and all the hard work that's gone into it. And my heart goes out to these young carers. It really does. And to everybody, actually, that's a carer, because we never know, anybody in this room can become a carer overnight. If somebody's in an accident or anything, you just never know. So we really need to look after people that care. My concern is young carers, as you can appreciate, and I'm glad you said that, Ellie, about... and you talked about schools a lot, and the work that's going off in schools, but I'd like to know what reaction you're getting from the schools, because some schools are, we're here to educate, and the mental health of these young children really worries me, you know, because it's bound to have an impact. And what sort of respite do they get, these young carers? So with that in mind, you know, and you talk about training of staff and in schools, you know, and I'm just worried about the reaction you're getting from schools because of the problems that these bring, you know, with them. I mean, it's... and picking up Jackie's point, and you know, I know quite a few people out there that have got children and the parents are worried as they get older and they can't look after them. You know, what help have you spoken to these parents? What's going to happen to my child when I'm not here? You know, because it's probably a long-term caring situation that they're in. So I'd like to know if you've spoken to parents and what you can do to alleviate their worries and problems. Thank you, Chairman.
Ellie, are you looking to pick this up, or is it Jackie? Who's going to start?
I can summarise school engagement, I think, because I think it's representative of lots of pieces of work we do. Schools engage in different ways, but you're absolutely right, that's the most vital point. And our service, Stafford Together for Carers, have already, but will continue to work with schools. They do things like school assemblies, so that not just school staff, but peers can recognise what a young carer might look like and how they can support their peers. So there is lots of work to do in that space, and you're absolutely right. Thank you.
Mike.
I think it's fair to say, and that some schools don't realise that some of their pupils are actually carers. And I think what we must do, we must educate and make sure that they do. And we must support the young children, because children need to be children. And whilst a lot of them are happy to look after and do the caring work, we need to make sure that there is respite put in place so that they can be children, they can do the activities that their friends do. And that's really important. Otherwise, they'll be affected from a very early age, and that will affect them for the rest of their lives. So it really is important that the schools understand who these carers are, that they make adjustment if that needs to happen, and that there's a level of understanding of what they do, as well as the engagement. And I think that's where the member engagement and the training will come in well. And I also believe that as members, we have a responsibility in our communities to make sure that people are aware of where people can go for help in this sector. So we will be looking at doing a bit of member training as well, just to make sure that all members understand where they can go for help, so that if they're asked in their communities where they can get help, you'll be able to at least be armed with that information to go out. But the children part, it really is important that we get, children need to be children, and we give the support that they need, and we're determined to make sure that happens.
Anne?
Thank you. I did ask about if you'd spoken to parents and that with with children that, you know, as the parents are getting older and the children need looking after, you know, have you spoken to any of these families as to how you can alleviate their problems? Thank you.
Jackie. Are you thinking about younger carers, or are you young carers?
I do apologise. I'm talking about older parents, you know, parents that's probably getting into their later life, shall we say, and they've got children that, and they're not children really. Yeah. I mean, I know of one instance where a young man is in his 40s, but his mum's just lost his father, but his mother is nearly 80, you know. So where do you go in that situation? You know, what happens to these people?
Yeah, I think there are probably 3 areas where social care professionals might engage with older carers who are or parents who are of sort of older children, as it were, as you say. So that might be through Stafford Together for Carers, who will look at contingency and long-term planning. It could be through the first contact team who'd carry out our carers assessments, so they would also have that conversation around sort of long-term planning. But it would also be part of, if a person is known to social care and has a social worker, then it could be part of that conversation as well about long-term planning there.
Thank you, Anne. Can I just come back to the previous answer that was given relating to schools, and just check whether the ambition is to send the new strategy out to maybe head teachers via the schools forum or something like that, particularly if the young carers are under-recognised, so to speak, because the only way of increasing that visibility is making sure that the schools have got the information in front of them. So is there an ambition to do that?
Absolutely, yeah, and I think there's other places that we can do that as well. Schools Forum, Send Inclusion Hubs, we can launch the strategy there, have it as a spotlight session. So, yeah, absolutely.
Thank you, that's good. Phil Hewitt, please.
Thank you, Chair. I read this report with interest, and I genuinely welcome it. My comments may be a little bit off-centre, so if they are, I'm happy to be picked up by you, Chair. Firstly, I used to be a carer, and I didn't know. And I wonder how many other people don't know they're carers. So I cared for a very close family member for a number of years before she sadly passed away. I had no idea I was a carer. I was just doing what a family member would do. So I read this, and it certainly has a certain emotion for me, so I absolutely welcome it. But the report, it needs to be delivered, but it's not about the report, it's about how we deliver it and the culture behind we deliver it. So I'll give you an example, Mr. Chairman, of an agency that used to call me up to check I was okay. So after a number of calls from them, my reply to them was, you are just one more job. So please stop ringing me, because you're just one more job I have in my life. Picking the phone up to you and saying, yeah, I'm absolutely fine, but I'm not fine, or I'm not fine. Unless you do something, can you stop troubling me? I think that was quite shocked at my answer, but my answer was emotive and meant to be shocking. Amazingly then, they did something, which was absolutely fantastic. So my challenge on this is the report's great. I genuinely get it. And I look to my left, my colleague and friend, Philip Atkins, when I first became a councillor too many years ago, was talking about people helping people. I remember that. And that's exactly the same as this. It's genuinely people helping people. So it's not the report, it's the culture. So if we get the culture change based on this report, then that's fantastic. We're not going to hit 100%. We're not going to cure every problem. We're just not, because nobody can. But we've got to look for culture change. And my challenge to you, Mr. Chairman, is we need to look at this again, and maybe again as well. So it'll be passed, I guess, by Cabinet on Wednesday. Am I right in saying that? So this will be passed by, and I encourage that to be passed. But we need to look at it again, and we need to look at it again, because this is really important on every level. You know, the base level is financial, but the real level is people, and the genuine level is people. And I wonder how many people, just like me, had no idea that they were carers, because I genuinely didn't, not a clue, just doing the job I needed to do a number of years ago, Mr. Chairman. I hope that wasn't too emotive, and I hope somewhere there's a question in there. Thank you.
Thank you for that, Phil, because I would agree with everything you said there. I was a carer and didn't recognise that being the case, or the support that was available. So I absolutely, wholeheartedly endorse what you have talked about. So who wants to pick up that? Jackie.
Hi, thank you. Yes, it underpins everything in a sense, how we identify carers, and I think that is the importance of how we engage with primary care surgeries in particular, so that GPs will be able to identify a carer and signpost them either directly or to the social care practitioner, so the social care prescriber in the surgery, so that people, when they present to their GPs, as most of us will at some point, is identified at that point and can be signposted there. We also have the carers awareness training, which will be mandatory to social care professionals, so that should help social care professionals to identify carers as well, understand the importance of carers and understand what services are there to support carers. And I think that is true, and that came out from some of the feedback that we got when we engaged around the strategy, is that even some social care professionals aren't aware that we have carer support services. So it's raising awareness across the board.
Phil, do you want to come back?
No, I'm fine actually. I'm absolutely fine. I think I can't remember your name. I think Jackie got what we was trying to say. I presume you did, Jackie. I'm quite happy that you got what we're trying to say. And it is, I'll reiterate my point, the report's great, absolutely welcome it. We've got to deliver it, but we've also got to deliver culture change, and I think that's absolutely vital. Thanks, Chair, and thank you, Jackie.
Mike.
Thank you, Chair. Yeah, Councillor Hughes is absolutely right. It is the culture change. But equally, we have to recognise that there will be many carers who actually don't want particularly much interference from us, that they're happy doing what they're doing. So we have to be mindful there are those people in the community who will want to continue doing that and not necessarily want to take any offer of support from us. I think the important thing is that we make sure that people are aware that there is help and support there should they wish to take it up. And we're not going to be sort of imposing on anybody, on any of the carers, because we know what valuable work they do, but we just want to be there to ensure that should they need support at any time, we're there to offer it. But you're absolutely right, it is around a culture change. But I do believe in the young carer strategy, getting into the schools and educating the teachers and the heads is really an important piece we need to do.
Thank you. Just picking up some of the sub-themes from what Phil talked about. You know, he talked about trying to make sure that every contact added value to him. And, you know, I always remember this sort of making every contact count as a strap line. But I think that is something that within what he talked about that I think needs to be carried forward to make sure that everyone really understands that there has to be some value from the engagement, not just a process. That's the first thing. Second thing is we reviewed social prescribing at the last committee. What was very obvious was that every partner has a different strategy, whether it's the NHS, the county, or Support Staffordshire. And I would encourage a common approach across the county for many of the services and support available. And the third point I'd just make is, in terms of metrics, I understand that there is going to be metrics going forwards. It is a pity that no metrics have been captured from the history so that we know what the baseline starting point is. That is a real missed opportunity in my view, because we don't know where we're starting from, and it should have been, in my view, part of the report, given the value that carers provide to not only their loved ones but to this economy. Jackie, I think you were indicating. Go on.
Sorry, thank you. Yes, it's just to say that we actually do have a lot of the metrics in place already. Some of those were prepared as part of the engagement around the strategy and the data collection around the strategy. So some of that we will get from the survey that we did, and it was important because that reached carers who are not known to us, and some of that will be from the biennial staff survey of adult carers across England. So we have a range of data already in place.
Thank you. Maybe you could, given the number of people who want to speak on this, maybe you could supply round to committee those metrics that you've got and what the outcomes you're anticipating at the end are, so that we've got some ability to hold your feet to the fire. And I think the one that Phil would be most interested in is the one, how do you measure the cultural change that's required? And I'll leave that one with you to think about. Baz.
Yeah, hi, my name is Baz Tamiz. Just wanted to ask a quick question, a couple of questions actually. One was about, do we know how much buy-in there is currently from schools and head teachers or anything like that? Do we have any conversations going on and what kind of buy-in there is actually at the moment? And the other one is about getting that message out. I'm just thinking about some of those GP surgeries, because most people will visit a GP surgery every so often, and often they do have that little screen on the top. And it's just, if it's about awareness, saying, well, actually, do you think you're a carer? This could be classed as a carer, kind of something to just trigger that. And they're the kind of moments that you can catch people. Otherwise, they do get missed. So just kind of picking up some of those areas.
I don't actually, about schools. So I'm happy, we'll have that data. So we will have how many schools engage with our Staffordshire Together for Carers service, how many school assemblies there've been, how many awareness sessions, because schools do have to organise that. So I can absolutely supply that data if that's something that would be helpful.
I think that would be really useful. Does that pick up your point, Baz? Yeah, thank you. Okay, let's go back to Charlotte, please.
Yeah, I very much welcome the strategy, but I recognise that this is going to be within existing resources and, in fact, no uplift for inflation either. And there seems to be a big gulf between the aspirations within the strategy and the actual report back from carers. For instance, they're saying their top 3 priorities, more support, including face-to-face support. And on page 27, you talk about breaks from caring, a range of affordable and personalised opportunities to enable carers to have a break. But, you know, when so many, I think 71% of those surveyed had no idea how to access respite care, how are you going to bridge that gap? And if we're looking at young carers, again, talking about support for young carers and talking about priority access for mental health services for young carers, when in reality, we're talking about a 6-month wait. So how are you going to bridge that huge gulf between reality, as seen by carers, and the strategy?
Jackie.
Thank you. Yeah, I recognise the points that you're making, and I think a lot does depend on how we identify carers in the first place and ensuring that they are aware of the services that are available, such as respite, and that they have an assessment, they are aware of their right to statutory carers assessment, and that they are enabled to have that. Eligibility for things like respite depends on the assessment for the looked after person, so our eligibility criteria will always apply. But ensuring that people are aware of the assessment and can have an assessment will make sure that, or will help us to ensure that carers are able to access a break when they need one. There was a question about resources as well. The services funded, carer services are funded from the Better Care Fund at the moment, and we currently do have an underspend against the Better Care Fund. So we're going to be looking at how we use that underspend to ensure that we can deliver more opportunities for taking a break from caring. I think the question around access to mental health for young carers is a longer conversation and probably not something that we are directly have control over.
I mean, given that 71% of those people eligible for respite care didn't know how to access it, what I'm really looking for is what steps are you taking in detail to go from the aspiration to actually delivering what carers need. Because once a caring situation breaks down, then the costs to the system are massive, not least the cost of the individual being cared for. So what steps in detail are you going to be taking to bridge that gulf between the reality as we now see it and the aspiration within the report?
So there are a number of areas that we're looking for in order to be able to identify carers, help carers to self-identify, and to ensure that carers are aware of what is available to them. So I've talked already about carers champions in primary care surgeries and in schools, so that will help schools and primary care surgeries to identify carers and signpost them to information, advice and guidance. And I also referenced in my report earlier our bid against the Accelerating Reform Fund. So we are looking at a digital solution online, so that will help carers if they're searching particular search terms, sort of carers' needs, isolation, loneliness, stress, Parkinson's disease. That feeds into Google searches, and that might bring up something like our digital support solution. So it's I don't understand quite how it works, but it's there in the algorithms to be able to respond to local searches and bring people sort of to our local digital solution. So we know that a number of local authorities are doing that around the country, and they are talking about how successful that has been in raising the number of carers who are self-identifying as carers and then approaching either social care or their local carers organisation for support. And then further to that, there is the engagement and community participation officer. So that will be somebody on the ground who will be working directly with communities to raise awareness within communities of carers, of the role of carer, that you might yourself be a carer, and supporting them to access carer services.
In the supply side, you know, you're talking about identifying carers, but what about supplying those respite opportunities? I mean, on page 27, it talks about them being affordable, personalised opportunities. You know, you're talking about identifying people as carers, establishing that they know that they're carers, and that the fact that they can go on digital online if they happen to be online. But what I'm interested in is the supply of respite care, because it's fine to identify who the carers are and that they may have a need, but how are you going to fulfil that need on the ground?
Respite care for people who have an eligible social care need for respite care sits elsewhere within our team, so I can't answer those questions in detail, but I can take that away and have an answer for you. But I am aware that one of the commissioning managers in my team is currently mapping supply and demand to ensure that our offer in the learning disability, autism, mental health and carers team is fit for the next few years.
I think committee would welcome having a written response to that. Is that okay, Charlotte? And I think the other thing that is implicit within what Charlotte's talking about is, because she's already into the action plan that's going to result from the strategy, so maybe once this has come through Cabinet this Wednesday and you've created the action plan, you could circulate to Zach the action plan as well that backs up this, and I think that will probably help answer some of the question. Kath.
Thank you, Chairman. Thank you for the report and the strategy. Can I say it needs to be executed, this strategy, and worked worked upon. Some of the figures that are in here now, I'm not surprised at, to be quite honest. Some of them are probably out of date as we speak now. I was just looking at page 20, and it was the census of 2021. We're now 2024. So obviously, there's going to be a change in numbers on that particular page. I can reiterate everything that Phil said earlier. When you're a carer, you don't realise you're a carer. If it's a family member, you do it because, for the love of. And that's probably what a lot of these that we're talking about now are actually doing, because they feel it's just natural to them. They want to care for their loved one of whatever. I am a bit sort of concerned, not concerned, but I have a little bit of a concern. As Phil said, when you're caring for someone, whether you're young or old, you don't want more interruptions. You need to be getting on with the job, for the want of a better word, even though you don't realise it's a job. And you don't realise, as I've said. So I think you've got a lot of work here, because there's a wide spectrum from 5 to, I'm looking from 5-year-olds upwards. Some of them are going to be missed along the lines. Yes, we've got future technology in IT and all of that, but everybody doesn't use IT, particularly if you're an older carer. You want somebody just to say to you, you're doing a good job, can I help you? Do you know, because they're not going to come for help. It wants somebody to say to you, I need help, you know, do you need any help? Rather than have to wait to get in touch with someone, because you don't want that extra job to do. So I am mindful it's going to be a big process to go through, and I think we need some feedback on this. It's good that it's been highlighted, because there are a lot of unpaid carers out there, And I think it's important that we do the best we can as an authority to help those unpaid carers out there, because it saves the county an awful lot of money with those unpaid carers out there. So we need to be mindful of the grand job that they do. And I know we do that because we have presentations and all kinds of things for carers. And that's all very well, but we don't recognise all of the carers that are out there. So I don't envy your task, but I think we need to keep on top of this, Chairman. So anytime you feel you need to come back to us, I personally would welcome it. So thank you.
Mike.
Thanks, Chair. I just wanted to come back to Councillor Atkins. It really is important that once we've identified that respite is required, and a lot of it is preventative because we know the money we invest in our carers now will help us long term, we absolutely have to make sure we deliver it. And we have to make sure that the finance is there to do that, because we need to look long term here, and money invested in this area will save this authority money in the future. So I will making sure that where we do identify those needs for respite care, that we have the mechanism in place to make sure that's delivered. And whether that means going back to Cabinet and asking for additional funding, obviously using up the underspend that we've got there, and more importantly, looking for other opportunities where we can apply for funding elsewhere to make sure that we've got that in place. So I'll give you an assurance, Mr. Chairman, that there's no point having a report if we're not going to actually deliver on it. And it will not gather dust on a shelf. It will get put in place. We will make sure that we support our carers, those who want to be supported, and we'll make sure that respite, when it's identified, when it goes through the criteria, is delivered, and that people get the support and help that they require.
Thank you.
Jackie, anyone else want to come in on Kath's specific point? Albeit, I'm just going to make one comment, which is currently the Health and Wellbeing Board is the committee that owns the strategy, by the looks of things. And we, this committee, scrutinises the work of the Health and Wellbeing Board, and we've got to be really careful that we make sure we understand who is scrutinising what. And for what reason. And I think we should just take maybe that one offline and have a conversation with the chair of the Health and Wellbeing Board. But do you have anything specific that you want to specifically come back to Kath on in terms of the comments about the importance and underrepresentation and the review?
No, I don't have anything specific to respond to that. But I'm sorry, could I just go back and clarify something, because we talked a little bit about the action plan coming back to this meeting, and I just wondered what the timescales for that were.
Yeah, not to this meeting. You can circulate it just as a written action plan, and whenever it is, whenever you have finished the action plan, and we prefer to see something that looks smart, as in the acronym SMART, rather than something that has got a bow tie to it or something like that. Kath, are you happy with where we're up to?
Yes, I think so. Yes, Chairman.
Okay, Richard Cox.
Thank you, Chair. I think it's all in the delivery, in not necessarily the strategy, but the strategy actually gives the guidelines. I am concerned, however, in a sense, if I look at rural communities section and also the travel and transport, I am concerned that there is an emphasis there on the digital answer. And I'm not therefore convinced that some isolated rural areas have got that coverage. And it makes me think, well, exactly how are you going to mitigate to those particular? I know there'll be a smaller number of people, but nevertheless, they're going to still require that assistance and guidance involved. So it does concern me there. Because certainly some parts of our rural community, they don't have any transport situations, and no doubt if it's a young person caring for their parents or one of their parents, it may be that because those people, they can't drive, for example. So of course it's clear that there has to be some form of within it. So the strategy obviously is emphasis on digital, but again, you've got to look at something that is looking forward. I assume we'll try and cover those anomalies, be it that obviously it might be in a small minority of people, but nevertheless each one deserves the guidance and help in the process. And I think my final other point would be, obviously, in terms of those youngsters that are there, and it's horrifying to think that, you know, that people, you know, say at the age of, I think the report says 5 and above, but I'm sure that there may be 1 or 2 that might be even below that, and it makes me wonder how on earth that they have that ability to look after, but they do, no doubt. And it's just trying to make sure that they, and I think Councillor Wilcox made the point in his preamble, you know, children should be allowed to be children, and it really is, you know, making sure we're covering that as well. So, thank you.
Mike.
Yeah, thanks for that. Thanks, Cox. I think we need to make sure that all the organisations that we come into contact with understand what the strategy is and what support we're looking for, whether that's through the GP surgery, whether that's through parish council, town councils. We need to make sure that everyone in the rural communities understands where the help and support is, because you're absolutely right. There will be those areas where we perhaps haven't got digital coverage, will be difficult to identify, but we've got to try every means we can to make sure that every organisation that we that we touch in any way understands that this is here, this is. So we need to make sure the comms on it is really good, because we don't want to miss opportunities and then find that later down the line that we have done that and then we're trying to retrack to where we are. So we'll make sure that at every opportunity we make sure that everyone is aware of the new strategy and aware of the support, and actually know where they can call and tell us if they identify someone in their community who they know is a carer that perhaps has fallen through that we don't know about, so that we can actually make sure that we're addressing that and giving the support if they particularly need it.
Thank you. Anything else, Richard? No. Philip.
Thanks, Chairman. Yeah, I've sat listening to the comments with intense interest, actually. And I think the gist of the debate seems to be about the delivery rather than the strategy itself. And like most high-level strategies, the devil's not in the detail, it's in putting it into action. And, you know, the fact that many people don't realise they're a carer has always been there. And also that if we're not careful, we go down with that top-down approach. And you mentioned the social prescription at the last meeting. Unfortunately, I had to leave, but when I listened to the figures about, it was typical NHS, they've created a huge plethora of people who were going to do it. And I know 1 or 2 of the social prescribers, and you work through the figures and you think this is costing a fortune to deliver something which ought to be very, very simple. And reading through the report, so we instantly think, right, they need a holiday. No, actually, if you read the report, I'd like somebody to do some odd jobs because I haven't got time or I don't know how to do it. You know, I know when I was on the Borough Council at East Staffs, one of the organisations there had got a handyman service. Don't know what's happened to it, whether it was Orbit or somebody like that. Nowhere in this is housing association, registered social landlord mentioned. It's all very high level. And if you're going to go down and picking up Charlotte's point, you know, we are in straitened times. You can either try and say, we need more money, we need more money. Don't spend it at the top level. It needs spending at the delivery side, if you did get any money. But we live where we live. So the big society is about how do you encourage people to help people. And you mentioned, Richard's just mentioned rural. You know, it's internet, fibre connect, trying to get it out there. There's no use putting a bus service on. The population's too sparse. You know, I had to forego the subsidy on one of my buses of £20 a passenger. You know, that is ridiculous. It'd be cheaper to buy a car and leave it in the middle of nowhere and leave the keys in it so that they could use it from time to time, as long as they topped it up with diesel or, petrol. So, you know, there's got to be a little bit of a common sense approach. And I think paragraph 7, where it says the Learning Disability and Autism Spectrum Condition Carers Forum. What a mouthful. You know, that's a typical one of large strategies. You end up with a title that's a mile long, meets probably once or twice a year. But we meet more often than that, and we should be having a look at it from time to time. I think the short and long-term planning is the really key bit about how we do that in paragraph 8. And I think in paragraph 9, there was something I noticed, work with partners to build and use community capacity to support carers. Please don't go down the avenue of creating even more bodies at a local level to do that. It's work with partners to use their and our community capacity to support carers. Picking up on what Phil said, most of us don't know that we fall into the position of being a carer. You know, I sort of skillfully engineered my mother-in-law to buy the property next door to us so that we didn't have to go 2 or 3 miles to go and look after it. You know, and knew that her capital was safe. We were looking after her. She spent the last 3 years in a care home, which cost an absolute arm and a leg. But, you know, and it certainly took a toll looking after her next door. We didn't have holidays because somebody else would have to be there. But hey-ho, that's life, you know. We'd arrange for somebody for a weekend. So you do a lot of it yourself. Young carers, a different thing. That's a really hard one. Where's the rest of the family? Children, you know, I hold a personal interest. My daughter works in Yachting Derby. How do you go in and help them? Very, very difficult. And and these things, Phil, can happen to you, Chairman, like that. You know, I know of somebody whose daughter sadly passed away last November, age 48, from a bleed on the brain. She's in her 70s, and she's now having to look after her grandson, who's 15, and who's got autism. I found out from my daughter, we don't call it Asperger's anymore because he was a Nazi supporter. So he's on the autistic spectrum, very difficult. What a change to her life of retirement to having to choose where she lives. She's living with at the daughter's house, coping with all of that, and she's got her own house as well. Support from foster caring or payment, zilch. Zilch. She's living it all out of her quite substantial pension as a widow. However, she's unknown and underneath the radar. So, you know, it's a difficult one. Partners, the school should know. They should have flagged it up and know where to go. So when you talk about partners in this paper, the Cabinet needs to be aware that there will be people in the school, in the registered social landlord, who should be looking out for these. You know, this is a partnership thing that goes far wider, which comes back to high level, and we're really happy here, we've done the strategy and forget about it. No, it's the delivery of it at a very, very local level. And just to add a bit of humour in it, my day job of farming and everything else, we've got exactly the same problem at the moment out there. You've probably seen the weather. There's water in all the fields. You can't do anything. The government have said we can only have money for the public good, so we're all going to go into environmental schemes this year. You can stuff food because it doesn't pay, because we can't plant the crops. So, as I always tell you, get an allotment and stock up on tinned food, because by the end of this year, there will be some sorts of food shortages.
Mike, are you going to...
I don't know that I can actually answer the food shortage situation for the farmers, but everything we hear around this chamber, Mr. Chair, we totally are 100% behind. We know it's about the delivery. It's not about the strategy. It's actually what we're going to do to make a difference. And we will report back to the committee once we've started to do that. Really important, because as you rightly say, it's no point having a document that just gathers dust. So we will be on the front, and we will make sure that, you know, we need to make sure that people are aware of the services that we have. And Philip's right, you know, the schools in particular need to be on board to make sure they understand the situation they find themselves in. Yeah. On the food shortage allotments, yeah, good idea, absolutely.
And I think somebody, I'm not sure if it was, I think somebody, I'm not sure if it was Phil, mentioned the important role of registered providers as partners, and maybe we just need to pick that up and factor that into the equation, given that I would expect a third of the population probably live within social housing, probably. Philip, do you want to come back on anything at all? But not on food shortages.
Not on food. No, but I think the allotment bit is, if you read through the report, there are things that other community groups do with gardening and that sort of thing that can help carers who've got problems with gardening. So it's a bit about, maybe some of our role is linking up people and having directories, helping people to help each other. You know, that was the thing.
Thank you, yeah, and really useful. And I think Phil, next door to you, made a very similar point in terms of communities helping communities. Jill.
Thank you, Chairman. Thank you for the report. I have to say that, in my opinion, it doesn't reflect what goes on in real life. I know many carers of all ages, and I was having a look at, I have as much control over my daily life as I want. No, you don't. I haven't met one carer that has control over their daily life, not one, of any age. And youngsters, when they're carers, and as almost everyone has agreed, it comes on so gradually. The child doesn't get up and suddenly have the relatives say, I need you to look after me today. It's gradual, it creeps, it becomes more and more demanding. Eligible social respite care, goodness me. Eligibility for respite care when you're a carer. I've seen carers on their knees so desperate just for a few days. And the difference between a young carer and an older carer. An older carer, if they're lucky, and Philip said, hey ho, that's life, and very sadly, that was a glib remark, but absolutely true. Hey ho, that is life. If an older carer needs even an hour's break, it's possible they'll get on the phone, any chance you can pop round just for a minute to sit with so-and-so, I need to do so-and-so, I've got an appointment. A young carer doesn't have that capacity. A young carer can't say to their schoolmate, do me a favour, go and sit with my mum for an hour. They can't do it. Because one, they won't do it, they're totally out of their depth. And to me, the whole crux of this matter with young carers is we're making out as though suddenly a crisis which has arisen within the family, which a young carer perhaps hasn't even noticed has arisen, it becomes massive. That crisis becomes huge. That young carer suddenly, it says 1 in 3 are suffering from mental health. Well, it's so sad that we're kidding ourselves that we can pick up the phone and ring the doctors and say, oh, I've got a young carer here with a mental health problem. Can you see them tomorrow? Like hell you can. It takes months and months to refer to the mental health services. And that's where we're failing these young carers. Older carers, fortunately, they recognise when they need help. They can reach out. And yes, there will be a waiting game, but they'll talk to their friends, they'll talk to their relatives. Young carers won't do that because they're ashamed of the situation that they're in. So, as most people have said today, the culture of us looking after our loved ones is slowly improving, but we're not there yet. And we need to be able to give as much help to these people as we possibly can. And I'm afraid that, you know, it's not going to happen quickly, but we are responsible for that. We've got to try and do something about it. And money investment, funding is something that must be a top priority to help all those people. Thank you, Chairman.
Who would like just to pick up anything from that? Is that a Mike or an Ellie or a Jackie?
Yes, can I just pick up regarding the point about sort of young carers and being able to access replacement care? Part of the role of the first contact team who carry out carers assessments and Stafford together when they do their carers assessments is when they talk to young carers, one of the things that they will work on is that contingency plan, so or an emergency plan, so that young carers know what to do when they can't care anymore, so that there are steps in place to be able to provide replacement care. So the social care workers will take a holistic approach with the family, so they'll look at the whole family's needs and make sure that they are met when they draw up the care and support plan for that individual.
And I think the point that Jill made was about the speed to get support from other professional bodies. That was the very specific example that Jill used. Given you're seeing the ICB this afternoon, will you carry forward, by asking them what specifically have they got in place to ensure the recognition of carers, young carers, to make sure that they get the right support at the earliest opportunity? Because I think that we're all aware of some of the delays within some services, whether it's CAMS or anything else. And I think that Jill makes a solid point in terms of linking up those conversations and services.
Just say, yes, I will do. Thank you.
Jill, do you want to come back on anything? Can you give us some feedback as well once you've had that conversation with the ICB? Written is fine. Mike.
I was going to say, Chair, I mean, the ICB have co-produced this document, so they have a responsibility, as we do, to make sure that is available, that if they need support and that they haven't got to wait 6 or 9 months, whatever the timescale. So, yeah, we absolutely, if they're happy to co-produce a strategy and an action plan with us, then they have to come to the table as well and have to deliver. Otherwise, it's no point in them being part of that strategy. So we will be pushing to make sure that they understand that we need to get better. We all need to get better. And you're right, I think slowly, the tide is changing and people do understand that, we do need to look after each other. That's the way it's going to be, unfortunately. There isn't enough resources to do everything, but very much so the ICB need to step up and be part of this going forward.
Thank you, appreciate that. Janice.
Yeah, thanks, Chair, and thank you for the report as well. I've been listening with interest with the colleagues' comments. I felt there was a good level of engagement, actually, when we started looking at the numbers across the county and how many people have participated in this. And I think the qualitative information that came through in particular couldn't help but resonate. And one of the comments that certainly did with me was that a statement that had been made about feeling forgotten. So whilst I appreciate my colleagues' comments as well about the actual action plan and the strategies being formulated into that, I was very keen to see the timeframes between 2024 and 2029. It seems like there's a lot to do, but there's some things in there that could actually be done quite quickly. So I would also echo comments for that to come back to this committee, Chair. But with regards to that element of feeling forgotten, there's an aspect and comments about certain aspects being automated. And I'm just wondering if there's some sort of steer and how you can give us an indication of the balance of between people being able to go in to access certain amounts of information via automated platforms, but also then not being forgotten and having those other aspects that I think would also significantly support them. Thank you.
Jackie.
Thank you. Yes, the automated platforms that we're looking at do have built into them they are AI based, so that they will be a certain persona within that AI platform, so that they can continue to contact that individual should they want it, to do a regular check-in. How are you? Are you okay? They can point towards our self-assessment forms, so that a carer, if they think they're at the point of needing additional support, they can complete their own self-assessment form online, and that will then come into our first contact centre so that they can access statutory services or further support. And we are also sort of looking at our self-assessment forms online as well, so that they're available by the county council, although that is more of a proactive approach from the carer. But certainly for those carers who are able to participate in the digital support solution, then that is more of a two-way process, so there will be that checking in process built within the functionality.
Thank you. Keith.
Thank you, Chair, and thank you for your report comments today. Two areas that I've got slight concerns about at the moment, because we are relying very heavily on the digital side of things, I think, in terms of the answer and the implementation of all this. We've had some elements before, particularly with Staffordshire Connect and that side of things, and the way that works and operates. You're talking of fairly complex, from what you've just explained from the last question, fairly complex arrangements in terms of how people are going to interface with what's going to be happening in the future. My concern is that is Staffordshire Connect being pulled in too many directions at once, with children's services, social care, as we've already mentioned as well, and with skivvies and all these other things, and family and community supports and all the rest of it, family hubs. I'm just slightly concerned that things are becoming a bit crowded in that particular area in terms of what we're looking for at the moment, and how this might work. And obviously members with a bit of training might be able to help out some of the local communities. That's something that you might want to take forward as some alleviation of this. But how can we guarantee that this is not going to break the camel's back is my not preferred statement, but an example of what might happen. How are we going to feed back how effective it is? How are we going to communicate with how many people are registering themselves? How are we going to try and make sure that what's happening at the moment is improving the environment? We've already said that people don't want to interface with others, so you're going to tell them to all go online. You know, it just, to me, there doesn't seem to be this, what was referred to as earlier, as a common approach. I think we need to be quite careful about what we're going to be doing and what we're asking these people who are in care of some support, and how we're going to relate to them. My second comment, I think, on this is, and yes, there has been some input from, I think, 20 children and 13 families out of, I think, 1,670, I think you named. I'm slightly concerned at that as well, in terms of the interface and what you're making decisions on now as being a big enough cohort on which you're taking this forward as a strategy, which is going to affect those 1,700 people plus. And with children as well within this, I noticed that each of the 7 points and 7 priorities you've got, you mention the children as an element within each of those 7 priorities. I think another one I would say to you is it worth taking those children elements out of that and have almost two parallel ones, because I think we're doing 2 different areas here. I think we're looking at children and supporting families with young caring and keeping their education going. You know, could the virtual school that we have in corporate parenting help out children that have to stay at home? That type of thing, the connectivity there. Are we trying to do too much in one area at one time under all these 7 topics? So that's my second comment. I think that if we're going to try and implement this, and I'm not saying we shouldn't, I think we ought to and we have to do this, I think that's what we need to maybe have a look at those options. And then finally, in terms of funding, because it's going to take a lot of funding to get all this happening at the moment, are the ICB and the health service going to add some money to this? Because after all, as we said already, this is their strategy, of which either we've written into or it's our strategy and they've written into it. Either way, it's going to take a lot of money to get this digitisation and this interaction and these inputs going. Surely they're going to have to contribute quite healthily, apart from anything else that we can apply for. Thank you.
Thank you. Who wants to, I think there were 4 points there. Who wants to pick up on those, please?
Yes, I will, thank you. So with regards to the digital question, the digital solution is an add-on to our existing services. So we will continue to have first contact team in Stafford County Council who deliver the statutory assessment process for carers and young carers. We will continue to commission Staffordshire Together for Carers to deliver carer support services. So that can be a range of in-person or digital online solutions. And we recognise that particularly for working carers, a digital solution might be best, but because they can access it out of hours. But there will be that continuation of sort of one-to-one support, access to a variety of support services through Staffordshire Together for Carers. So the digital is an offer on top of that. Just to pick up the funding question as well, I'm probably moving around quite a bit and I apologise for that. But the funding for the digital solution, for the first 2 years, we have accessed funding through the Accelerating Reform Fund. So that will be funded via that route for the first 2 years. A key element of the Accelerating Reform bid must be that it is sustainable, but it will give us that, allow us that time to look at the metrics, understand how it's being used, understand what the feedback is from carers, how they're finding it, and then sort of to look at funding going forward beyond 2025 or 2026, I think, when the actual funding ends. So that will give us that time to do that. Staffordshire Connect's question, I'm not entirely sure about that. I would have to come back about that. So I'm sorry for that. Have I missed something? Because I might not have picked all the points up there.
So I think the other two that I picked up, one was about the size of inputs, the number of people involved in the strategy, which from my perspective looked like a lot, in fairness, given the number of people who normally input to strategies. But I'll leave you to answer that. So that was the first one. And the second one was there was a challenge as to whether a children's only strategy would be more beneficial. I'll leave those two with you and Ellie, possibly.
Okay. Yes, so going back to the first point around the number of carers who responded to our sort of various surveys and focus groups, which was 412. As you say, that was 20 young carers. So yes, we recognise that was a very small percentage of carers overall within Staffordshire. However, we are assured that what carers have fed back to us, small proportion of carers who have fed back to us, is representative of carers' thoughts and views more widely, because it corresponds with what carers told us for the engagement to the previous carers strategy in 2018-2019. It also aligns with wider feedback that we're getting through colleagues in the old people physical disability team who are engaging around their carers strategy and also their day opportunities work that they're doing as well. But it also aligns with what carers are sort of saying on a national basis. So when we look at information coming out from Carers UK and from Carers Trust, it very much aligns with what carers are telling us in Staffordshire. So although we do recognise it's not necessarily a sort of a really large number, we have confidence that what carers are telling us is an accurate representation. And I think Ellie apologies, wants to pick up on the young carers element.
I think you're right. I think there could always be an opportunity where we could have dedication for a cohort young carers. I think the idea of this was integration, really, that it was ICB and the council, and that it was an all-age offering, so that especially around that transition, supporting a young carer to go into adult life and what that role looks like. But I do appreciate that sometimes there's a call for that dedication.
Keith? I'll just say, as long as those two comments are taken going forward, that we do get a bigger cohort to get some response back from in the future, and to make sure that if children and families with children who are carers and need additional support, if they do wish to have those elements sort of looked at in a more focused manner, that we do for granted that it fits in within everything else. I realise that we're trying to do something as a partnership, and that's new in itself, but I do think we do need to not necessarily lose focus, because I think these particularly the younger carers and everything else, do require a slightly different approach to the older carers, which I think we've pointed out with already numerous times. Thank you.
Thank you. Maybe there's also an approach to have a mid-term review, given that there's it's a 4-year strategy. You know, rather than having sort of, you know, a focused piece of work at the end of the strategy to create the next one in 4 years' time, maybe after 2 years there is a bit of work to go and check that the strategy resonates and delivers for the individuals, and then it's a bit more of a seamless update rather than anything else, and that would pick up maybe Keith's point, and that might be a useful thing to do. David.
Thank you, Chair. Firstly, I just wanted to acknowledge the brilliant and tireless work that all carers do in Staffordshire, and I think this strategy is a real big step in that direction. As someone interested in technology, and we've sort of danced around it for the last few things, is really I just want to know the specifics around what this digital support solution is. Is it something that I understand it? What could you just give me some more details around that? And also a further question from that, I guess, in priority B is we'll explore the best use of digital solutions to identify adult carers early, help them self-identify. What is that digital solution that will, I guess, identify these carers, and then will there be any, how will that then communicate with other systems? So I see this as it's a joined up strategy. You know, if someone identifies to you or to the GP to say they're a young carer, how will that then follow them through? So in that interoperability, to use the correct term. So yeah. Sorry, I sort of work in technology as well, so I threw some terms out.
No, not at all. I'm not a digital expert either, so sometimes I get a bit baffled. A couple of the common products to have a look at might be Mobilise, and there's another organisation as well. It's just slipped my mind completely. It'll come back to me. But there are a couple of big players in this market, and it is a growing marketplace as well. I'll just hope that name comes back, I'm sorry. So those are a couple of ones to have a look at, and I think they take different approaches. So Mobilise, I think, is very much about signposting carers to different support services in their local area. I know carers have fed back to me when I've talked to them in focus groups that they found it really helpful because it gives them lots of information. It signposts. It might signpost to sort of Staffordshire Connects, in fact. So things like that. It could signpost to Staffordshire County Council. So you know, try and promote our preferred pathway around access to carers services. So the other solution that we're looking at as well, and we have been, I think a number of organisations in the West Midlands, local authorities in the West Midlands are looking at this one as well, because they think it has a lot of potential as part of the accelerating reform bid and the potential collaborative approach across the West Midlands. And that one has the AI built into it, so there is a persona in there. So for instance, I might pop up as one of the preferred personas that could talk to you and ask you questions. So it'd be, what would you like to know about? What is your question? And I could put in, I'm a carer, I'm very lonely, I live in Staffordshire Moorlands, what is available to me? And then gradually it will build up a file of information for you, if you like. So that would say, well, are you aware of sort of these local groups here? Are you aware of Staffordshire Connects? Are there any other sort of questions that you have about the cared for person's diagnosis? So it gradually builds a picture, and it provides more and more information about the kind of questions that you would like more information about. So that one is quite interactive. I sort of have seen that one a little bit more than I'm aware of Mobilise. And that will, as I say, that creates a whole portfolio of information for you based on what you input into there. That can also generate a self-assessment form. So people can fill in that self-assessment form online if they wish and say, yes, I'd like to share that with the local authority. They can build their own support plan within that solution as well, and that will then sort of be there so they can go back and refresh it, they can update it with more information, and it will scrape not only from Staffordshire County Council website, but it will bring information in from sort of national websites as well. So you have sort of the most up-to-date, authoritative and relevant information that you have via that platform as well. Yeah, so I think those are probably the two main ones, and hopefully if I can remember the name of the second, I can't believe it's gone out of my mind. Could you remind me of the second part of the question, please?
I'm trying to think now what my second part of the question was. It was about the identification of carers. It looks like we're going to try and do that using a digital solution. Is that part of the solution, and how is that information then going to flow into other systems? So I'm thinking if you've got the ICB involved, there's a Staffordshire shared care record. So how is that information going to be transmitted? So, you know, a GP says, oh, you know, as a conversation goes, oh, I didn't realise you was a carer. How is that information then going to be passed on to the other bodies?
So in terms of that, I don't think we know yet. That will be a conversation with the ICB, because every primary care surgery will work in a different way. Obviously, GPs have an enormous workload already, so we need to sort of work with, I think, as a collective group of GPs, what would work for them best in terms of being able to support, identify carers and signpost carers to relevant sources of information. And I'm anticipating that might differ quite significantly across GPs. So some will have the plasma screens, as we heard about, in the waiting areas, and we'll be able to put information on there. Some surgeries might have the social care prescriber who will be acting as a carer's champion, who will be able to help identify carers. Some of it is about helping carers to self-identify, and I think we've heard that quite a few times sort of around the chamber this morning, is that people simply don't recognise that, one, that they're a carer, and two, that there is additional support out there for them as carers. So that's where we want to be really proactive. So it's those key points when carers come into contact with their primary care surgeries, as young carers, their schools, or with social care professionals, that we're reinforcing that they're sort of saying to them, do you realise you're a carer? And there are these support services available to you. So some of that will be, probably a lot of that will actually be around training of staff to let them know what is available as well.
David, does that cover it? I don't think that was this sort of answer to your question.
No, but I think, yeah, it seemed, I think that's something to be fleshed out in the details, I think, yeah. And just finally, because it's not really in this, is we've spoke about sort of rural digital communities, but how are we going to address sort of digital poverty and digital inequality? So obviously carers tend to be, not as employed as other people, or have less money, or have more outgoings. How are we going to mitigate that so that they can use technology like someone else would? So that could be data, or it could be access to the technologies, things like that.
So the Community Engagement and Participation Officer, funded by the Accelerating Reform Fund, will give us that 2-year window to look at how we engage with carers who are digitally impoverished, who might not have access to it for rural, because of rural broadband issues, because of issues around affordability of technology. So over the next 2 years, that will help us to sort of understand what that picture looks like and how we can support carers. But there is also the one-off payments, the carers one-off direct payments part, so that could be used as well to fund individual pieces of kit. So that helps carers to remain connected, to go online, to find out what support is available, or to sort of join peer groups remotely, those sorts of things. But there is also within the First Contact team, they have just had a business case approved to appoint 2 new staff within that team, and one of those staff role is very much around digital technology and assistive technology, and that also covers carers, and it will have a similar role, probably a wider role, because it covers non-carers as well. But that will be around supporting people to access digital technology, and that also has a budget tied to that as well. So that can be used to purchase pieces of equipment as well.
Thank you, that's useful. I do want to try and bring this debate to a close, so very briefly, but I just have 2 points related to what you've just said. First of all, how can you ensure the security of the data? Because here you've got a platform that is pulling together some very potentially vulnerable people, and how can you ensure the data security? And if you don't know the answer to that, that's fine, because I'm aware that you're procuring a platform, so the answer may be further down the line, but please take that into account in the procurement. And second of all, would it be useful to put together a webinar so that you can demonstrate, once you've chosen the platform, what it would look like? Because I think there is a lot of questions in terms of how that looks on the ground. Clearly, you can't answer all the detail today because you haven't procured it yet. So maybe there is a follow-up session on that. So just those 2 points, and then I'll bring in Anne Edgeler, and then that'll be it. Okay. Were you going to come back to me on my 2 points?
Yes, I will do. Yes, I think so. The webinar is an absolutely brilliant idea, and that will show the functionality of the two platforms. And being as we haven't actually procured it yet, in any case, then that might be just we could show you, just send links out to those two platforms as well, and that will help members to have an idea of how that looks as those two platforms work. And regarding the data security, yes, very much. We are looking at that as we go through the procurement of the platform. We are looking at a West Midlands consortium approach, so potentially going through Crown Commercial Services for the procurement of the digital platform. But we are very much mindful about data security as we go into that procurement.
Thank you. Anne, very briefly, please.
Yeah, just one quick question. Thank you, Chairman. Yeah, we've talked lots about children, young carers, but children that are not carers are waiting a long time for access to mental health services. And my concern is, have you had any discussions with Midland Partnership Foundation Trust or CAMS regarding this situation so that they can move, I'm not saying up the ladder, but get help quickly? You know, and are these young carers aware of where they could probably go if they just want to chat to someone like Minds or Samaritans? I just asked that question. Thank you, Chair.
Just in terms of the first part, we've already answered that because you're going to take it away to this afternoon's ICB meeting. So that part you don't need to answer. But the second part you can pick up, please.
Yes, we do already offer young carers counselling through the Stafford Together for Carers services, so we are going to continue offering that service.
Thank you. That was 90 minutes where I think we've taken a really important strategy and dissected it a number of different ways. The real value of carers can't be underestimated. I think it's been said, Burgess, but every speaker this morning. It's unusual for us to have nearly everyone in the chamber involved in this morning's debate, so I think it gives you an indication of how seriously we take this. But also recognise the value of everything that people do and respect that as well, because it's really important for not only their loved ones but also for many in the community. There were a whole rook of different recommendations we've got. I don't intend to go through them now because I think I've got 7. We will put them on an email for you before tomorrow lunchtime, just to make sure we've all got the same elements. I don't think there was anything salient that turns around and says that we are not in support of the strategy. Quite the contrary, I think we're in very much support of the strategy and recognise the challenges that are ahead in terms of the cultural change, but also welcome some of the thinking that you've brought forward on this, specifically recognising young carers, because I think that is a very critical group and also a very pressured group as well. Is there anything that committee wants to add to that brief summary? And in which case, I think we should thank you for your involvement. It's clearly a long journey because you've now done 3 committees of various different types, and you've still got the ICB committee, no doubt, to navigate as well. So we wish you well with that, and thank you for this morning's interventions and input. Thank you. Let's move on to agenda item number 6, which is District and Borough Health Scrutiny activity. John.
Thank you, Chair. Just a quick bit of flesh on the bones of the Moorlands District Council one. What you've got in front of you written down is correct, and it was discussed as annotated there. But just to add, you'll be aware that there is a campaign to bring the ambulance service to account for rural performance with a public inquiry, and that just is gaining momentum in the Moorlands, and I'll keep you updated on that. But the other thing was, as you're aware, Chair, a few of us from this committee went along to the Harplands. I wasn't able to go to St George's last week or the week before, I can't remember. And I reported on that to our committee last week, and I was quite impressed with the presentation from the Harplands. I thought, came away from there thinking they're doing a pretty good job. And I indicated that to my committee and promptly had my legs chopped off by 2 or 3 members who begged to differ. Just to make you aware then, Chair, we are proposing to invite both MPFT and NSCHT along to the district committee. They did offer at the Harplands, as you know, I wasn't able to go to St George's, but the Harplands did offer to come and see us at Leek, so we are going to do that, Chair. So it's just to keep you informed, Chair. Thank you very much.
Thank you. Just in terms of the 2 points you've made, we are in the process of writing to the West Midlands region asking for or giving our support to an independent review of the ambulance service, which I think is probably going further than you're talking about, but that's what we are doing. But I would prefer you not to replicate what we're doing, because otherwise it calls into question the purpose of individuals' activities. That's the first one. Second one, in terms of Heartlands, just we need to be very, very careful that we don't duplicate what this committee does. There's a very clear terms of reference, and I would always encourage members to look at the terms of reference and just make sure that we're on the right side of it. If it's a local issue, then by all means, local committees should determine what they're doing and have a clear focus, because I can remember the words of the Francis Review, and it rings through my ears time and time again, and Councillor Edgeler knows exactly what I'm going to talk about because we already talked about it. So I would just encourage those 2 elements, if that's okay, please.
If I may, Chair, I am fully aware of the joint code of working, and we will not try to tread on anybody's toes, but particularly the ambulance is a local issue as far as the Moorlands is concerned. And the Harplands, as I say, the Harplands did offer, whilst we were there, to come along and speak to my committee, so I'll take them up on it, and then they can be accountable to my members locally. And there's no desire to duplicate work, Chair. It's just a matter of addressing local concerns. Thank you.
Yeah, I mean, we can address local concerns through any committee, whether it's this committee or another one. And I would argue that ambulance service, because Councillor Perry would cut my legs off, so to speak, if I didn't say it was not just a Moorlands-based concern. I welcome the work you're doing, providing you don't tread on this committee's toes, please. Okay, I think Anne Edgeler is indicating we're not going to go back to Francis, are we?
No, we're not going to. I remember that day very well, thank you very much. No, on page 92 on the Stafford Borough, there's a correction there. It says the next meeting will take place on the 31st of March. In actual fact, it's the 21st of March. Thank you.
Thank you. And does anyone else want to add? David.
Thank you, Chair. I just want to acknowledge that the reporting from Cannock Chase District Council could be better. And just to update you all, we are meeting tonight, and where we have had a working group around the lettable standard for housing in our authority, and we'll also be reviewing the performance, and I'll be feeding back from this committee. So I wanted to keep you all in the loop about what's going in Cannock Chase, and just to acknowledge that we need to improve the reporting from my council's side, so that this council has sight of what we're up to. So thank you, and I'll be speaking to officers about that.
Thank you, we appreciate that. And Councillor Edger did quite some work 2 years ago, I think, in terms of the importance of housing on health. And clearly that, I think, is a well-made point. Okay, Phil.
Thanks, Chair. East Staffs Borough Council committee is going to meet tomorrow night, and unfortunately I can't get there as I'm down in London and trains and everything else. I'll never get there in time. They seem to be operating quite well. Health is buried in one of their committees. But I was just picking up on your comments about the ambulance and Staffordshire Moorlands and everything else. And I was particularly pleased to see Roger Thane being interviewed on television as Chief Executive of the Staffordshire Ambulance Service before it got submerged into the West Midlands Ambulance Service. And his comments on rural areas that you could never get there because you'd need to have an ambulance virtually on post all the time. And I remember when he brought in the service that we had, which was award-winning and top of all the lot. You know, remember that? We had the best ambulance service in the country. And he abolished the ambulance stations, so there was an outcry about that. But he said that all the ambulance stations were in the wrong place. You needed ambulances waiting to be called out, which is what we've got standard practice today. And they were filling the gaps. You needed community first responders to get there really quickly because the first 3 to 5 minutes of any heart attack are vital. And the first community responder was Neil Phillips in Uttoxeter. And I'm pleased to say that I have Elliston and Mayfield, Dove Valley, Churnet Valley. There's the Uttoxeter. I don't know what's happened to that, to be honest. Abbots Bromley, first responders, who are still going out there and being funded by the communities. If it wasn't for them, we may have a problem. And so it goes back to the earlier debate about the community response to these things. And, you know, I agree with the sentiments, but that we have to accept what we have. And I know from talking to my community first responders, the West Midlands Ambulance Service has made it very difficult for them and the work that they're allowed to do. And that is something that we should be pushing back on.
I think we're getting, I mean, thanks, Philip. We clearly saw West Midlands Ambulance Service in the end of November. I think we're getting a sentiment from committee members that it'd be wise to bring them back as and when we can. Okay. Anyone else want to pick up? I'm going to go to Janice in a minute.
The Environment Agency.
Funny enough, I've got the Environment Agency on my list as well, but we'll talk about that in a minute. Yeah, exactly. Janice, do you want to give us an update in terms of the working group, the Women's Health Working Group, please?
Yes, Chair, thank you very much. I do indeed. First of all, a big thank you to those that have been involved in some of the work that we've been doing on the working group. We did have a transfer of some of the members, so whilst we might be small in number, I think we are big in ambition, it's fair to say. Colleagues, following the publication of the government's Women's Health Strategy, we then put the working group together and started to look at what we can do to bring it down specifically to Staffordshire. And with the invaluable support of the lead ICS officer for Women's Health, Dr. Lorna Clarkson, we were able to access a report that gave us an awful lot of the data that was able to steer us in the direction that we felt that we needed to. But this gave us our evidence to be able to support that. And at this stage, we are being able to put together a briefing paper, which I'm keen for everybody to have sight of following this meeting. We've started to focus specifically looking at the people and the processes. And we've taken our first topic, being endometriosis, as one where we can use as a test to see how we can refine what we are doing with the people that are involved and how that can have an impact with regards to our next steps from the County Council and also from other providers such as primary care networks as well. So I'll be keen to get that shared out, and if people want to get back in touch, by all means do. But it's great to see that we're seeing some good next steps and actions coming out of the work we've done to date. Thank you.
Thank you for the work that you and the team are all doing. I think it's really important and replicates what's been done nationally as well for the first time, I think, which I think says too much, unfortunately. But I'm pleased that you're leading that. So thank you for that, and thank you for the update. So that brings us on to work programme. and I'm going to make two suggestions. I think everyone's got the dates for committee going forwards. Obviously, committee needs to be appointed post-May's elections and other bits and pieces. But I think that everyone's got those dates for the diary. I'm going to suggest that early on in the process, in terms of the programme, we get both West Midlands Ambulance Service in and bearing in mind my comments about Wally's Quarry, I'm going to suggest that it's high time that we invite the Environment Agency and Health Protection Agency, can't think what they're called these days, back in to talk about what the health impacts of Wally's Quarry are. Ian, have you got anything you want to say in terms of Wally's Quarry?
I'll give you a bit of an update. I've had one this morning. We are having a working committee to look at the full history of it, as it's been going on for quite a few years, on and off, and the history of it sort of gets a bit clouded in what was, what wasn't. So I've asked them to look at it from the beginning, as soon as the first shovel went in, from when the borough refused planning permission on it and the county, which was overruled by the then government. So the idea is to look at it all and look at how many times the Environment Agency has been contacted all the way through, and to see what the result comes back as there. Bit disappointing that the Environment Agency didn't go for the full closure, but you know, there was a statement put out by them that they have to go down all avenues. So they have gone down the avenue of suspending. So if there is any more problems, I imagine the next stage, according to how they wrote it, is a full closure. So we keep his eye on it and keep on looking at it and expect what we expect.
But I think in broad terms you're in support of committee reviewing Wally's Quarry's health impact again, given that the issues continue.
Yeah, the health impact is going to carry on. It's already carried on. The problem you get, the advert where you get nose blindness, you literally do. So even though some aren't smelling it, and it's still about. They get used to it, and that's unfortunate. So yeah, definitely. And if you can get the Environment Agency here, you're a better man than me. Go and go down.
Given that they empty-chaired us last time round, I'll wait and, but with bated breath, let's put it that way. So are we in favour of those two items being top on our agenda for the next municipal year? Yeah. Thank you. John.
Just quickly, Chair, I don't want to sound like a crack record. I would like to see the ambulance service back here, and probably 2 or 3 times a year, but that's not what I wanted to speak for. On the 13th of November, we said we would have a, quote, summit meeting with them, and then it was turned into a visit to EOC, I just haven't seen any dates for that. I think I did have a quick word with Zach before the meeting. I believe they are not engaging more than we're not trying. I think we should push them quite hard to get that meeting stroke visit arranged, Chair. Thank you.
Thank you. So first of all, the summit is not the same as the visit to the call centre, 2 different things. We are working on a date for the call centre visit. The dates that I was offered, I couldn't do, so I've asked for some more dates, which will be into May now, because they were a limited number in April. That's the first thing. In terms of the summit, we have talked to a number of partners, and at this moment in time, because of our request for the independent review, it's felt that that's not the right way to go first. The independent review is the right way to go first. But the visit to the call centre is designed to try and identify some of the issues that you've seen very locally, which relate to defibrillator access, amongst other things. Anne.
Just to say, Chairman, can we have the Chief Exec from the ambulance service come to our meeting and not his sub? Thank you.
Unfortunately, I don't think we have the power to insist who they send. Our partners are generally very good in sending the most senior person applicable. We can make a request on your behalf, Anne.
Can I just support that,
We're not going to ask for everyone now. We go on. You know, let's
It's not what I'm sending the PR team every time.
Okay, I think we've got to 12:20. Unless anyone else has got any further business, I'm going to wish you a good afternoon. Thank you for your input to this morning's meeting. And before we all go, I'd just like to say this is the last meeting of this municipal year. So in terms of end-of-term report, thank you everyone for your engagement, your intelligence and your insight, particularly with the range of people that we have scrutinised over the last 12 months. Second of all, thank you to the officers who have made sure that we've kept on the straight and narrow and followed stuff through to a conclusion. I really appreciate the professional input that we get. And third of all, they're not here, but thank you to our guests who do honour us generally by sending the most senior people that they can to have the most relevant debates that we can. So thank you for that. Take care, and I hope you're with us for the next municipal year. Thank you.